If you suffer from high blood pressure or hypertension, then lowering it even by 10 points can reduce the risk of serious problems like heart attack, stroke, and kidney failure. The closer you get to blood control, the lower the risk. So how can you have the best control of your blood pressure for a healthy life ahead? Here are 5 must-know things that will help you lower and control your high blood pressure. Number 1. Know your numbers. High blood pressure usually doesn't cause any symptoms. The only way to know if you have good control is to have it measured. Knowing your numbers will help guide changes in your lifestyle and medicines, and you will know if your blood pressure control is at target. A good blood pressure is 120/80 or less. For those who suffer from high blood pressure condition, your goal is to keep it under 140/90. The better the control, the better it is for your health. If you have high blood pressure, then check it frequently, like once or twice a day and at different times of the day. Maintain a record of your daily blood pressures so you can see how good the control is, and your doctors may make the right decisions about your treatment. Number 2. Regular exercise. Regular physical activity can lower blood pressure by 5 to 8 points. As a general rule, try at least 30 minutes of moderate exercise 3 to 5 days a week. Some examples of moderate aerobic exercises are brisk walking, jogging, cycling, and swimming. Regular exercise keeps the heart and blood vessels healthy and lowers your blood pressure. It also has other benefits for diabetes, cholesterol, bones, and mood. Number 3. Changes in your diet. What foods you eat and how you've prepared them can affect your blood pressure. There are 3 changes you can make in your eating habits to lower your blood pressure. The most important change is to cut down on the amount of salt, which is also known as sodium, in food. Take less than 1,500 milligrams of sodium in a day, which is equivalent to 1 teaspoon total of salt per day. This much salt is already naturally present in our foods, so do not add extra salt to your food. Some foods can have a lot of sodium. Processed food, deli meats, canned vegetables, soups, and frozen meals can be very high in sodium. Snacks such as potato chips and others often contain a lot of salt. Limit restaurant foods and fast foods as they usually contain high levels of salt. Food cooked at home prepared with less salt is healthiest. Fresh or frozen vegetables tend to be low in salt. Many herbs and spices without sodium can add great taste and are healthier than salt. If you go to a restaurant, look to see the nutrition content and choose options that are healthier for you. Another change is to follow the DASH, or Dietary Approaches to Stop Hypertension, eating plan, which can help reduce blood pressure by about 10 points. DASH diet includes food rich in whole grains, fruits, vegetables, poultry, fish, and low-fat dairy products. Avoid foods high in fat, such as butter and margarine, fatty meats, whole milk dairy products, fried foods, processed foods, and fast foods. The third change is to make foods that are rich in potassium a part of your diet. Potassium balances the effect of sodium on our blood pressure. Examples of food items that contain potassium are spinach, broccoli, beet, tomatoes, potatoes, beans and lentils, bananas, oranges, almonds and cashews, milk and yogurt, chicken and salmon. But before including food rich in potassium in your diet, make sure to discuss this with your doctor, as people with poor kidney function and those who take certain medicines should not take high potassium diet. Number 3. Know your medicines. Although diet and exercise can lower blood pressure, if the blood pressure is still higher than 140/90, medications play a very important role in lowering your blood pressure to goal. There are many different types of medicines available to reduce blood pressure. Learn of which your medicines are for high blood pressure and take them regularly as advised by your doctor. If you experience any side effects that concern you, talk to your doctor as soon as possible so they may change your medicine or its dose. Don't stop the medicines without discussing with your doctor. Do not be discouraged. Finding the right dose and combination of medicines to get your blood pressure to 120/80 can take time. It can be common to need combinations of medicines. Taking your medicines every day as directed will help keep your blood pressure under control, which is very important to preventing strokes, kidney failure, and heart diseases. Follow up regularly as directed by your doctor to achieve a healthy blood pressure and be sure it stays at goal. Number 5. Other lifestyle changes. A few lifestyle changes can also make an impact on your blood pressure and overall health. Maintain a healthy weight. You are more likely to have high blood pressure if you are overweight. Maintaining normal body weight can help reduce high blood pressure by about 5 points and lower the risk of complications. Poor sleep quality can also contribute to hypertension. On average, adults should aim to get 7 to 8 hours of sleep daily. It's not just the quantity, the quality of sleep also matters. Watch our videos to learn tips for better sleep. If you snore, you may have sleep apnea, which can affect your heart and blood pressure. Let your doctor know if you snore or have fatigue or headaches in the morning. If you smoke, then try to quit smoking. Apart from increasing blood pressure, smoking itself also damages the blood vessels. Stopping smoking is one of the best gifts you can give to your body. Remember, it's never too late to quit. And lastly, dealing with chronic and constant emotional stress may contribute to high blood pressure. Avoid stress triggers, find ways to help reduce stress, practice mindfulness and gratitude to help relax. If you are dealing with constant stress, then seek professional help to manage it. By being informed and learning these essential tips about your blood pressure management, I hope you will be better positioned to take control of your health and plan for healthy years ahead. Stay healthy and help others stay healthy.